Do you ever find yourself feeling unexplained fatigue? Or perhaps you've noticed your balance isn't quite what it used to be, maybe even a little dizziness, or a persistent low mood? These aren't just frustrating signs you might chalk up to getting older. They could be your body sending critical early warnings about a hidden threat. Many seniors are silently battling nutrient deficiencies that are quietly but powerfully weakening them from the inside out. The truth is, these are fixable problems, and recognizing them can dramatically improve your independence, energy, and overall health. Stay with me until the end of this video and you'll discover the 5 silent nutrient deficiencies that are robbing seniors over 60 of their vitality, and most importantly, how to fix them fast. Welcome back to Health Facts, your trusted guide to healthy aging. In our last conversation, we explored the impact of certain fruits on seniors' health and how some perceived healthy choices can actually pose risks. That discussion underscored a vital principle: what you consume fundamentally impacts your health, especially as you age. Today, we're diving deeper into this principle by addressing a common yet often overlooked challenge for older adults: silent nutrient deficiencies. You might be wondering, how can a deficiency be silent? What are these specific nutrients and how do they weaken seniors? And most importantly, what practical steps can you take to rapidly replenish these vital elements? We've invested countless hours sifting through the latest scientific literature, consulting with experts, and compiling actionable strategies to answer these questions comprehensively. Our goal is to equip you with the knowledge to reclaim your energy, improve your balance, and boost your overall well-being well into your golden years. Let's uncover these hidden threats and empower you to take charge of your health. Let's kick things off with a crucial mineral that acts like your body's unsung hero: magnesium. Imagine your entire body as a complex electrical system, constantly sending signals between your brain and muscles. Magnesium is the master manager of this system. It's involved in over 300 biochemical reactions, many directly tied to how well you can move, balance, and maintain stability. But here's the concerning part. Studies reveal that an alarming up to 80% of older adults don't get enough magnesium in their diets. This isn't a sudden drop, it's a gradual depletion exacerbated by dietary changes, reduced absorption as we age, and even certain medications. What's the story of a magnesium deficiency? Well, without sufficient magnesium, those vital signals between your brain and muscles can become garbled like static on an old radio. This can manifest as unexpected muscle contractions, weakness, dizziness, and ultimately a significantly increased risk of falls. Think about those moments when your legs don't quite listen or you feel unsteady on your feet. Magnesium also plays a direct role in heart health, acting as a natural calcium blocker in heart cells. When there's too much calcium and too little magnesium, your heart can become hyperexcited, leading to irregular heartbeats, palpitations, and even high blood pressure. Many common high blood pressure medications can cause magnesium loss through urine, creating a challenging cycle. So, how can you replenish this powerhouse mineral? The payout is clear. Incorporate magnesium-rich foods. Consider cooked spinach, which provides around 157 milligrams of magnesium per cup, and cooking it helps break down oxalic acid, making the magnesium more absorbable. Pumpkin seeds are another champion, packing approximately 168 milligrams per ounce, along with anti-inflammatory compounds and zinc for nerve regeneration. Black beans offer about 120 milligrams per cooked cup, plus steady, slow-releasing energy that helps stabilize blood sugar. And for a creamy, nutrient-dense option, a single avocado provides about 58 milligrams alongside potassium and healthy fats. Even a square or two of dark chocolate, 70 to 85% cocoa, can contribute around 64 milligrams per ounce, while also supporting circulation to the brain and inner ear. If you're considering supplements, the citrate and glycinate forms are recommended for better absorption, with typical doses ranging from 300 to 600 milligrams per day, preferably taken before bedtime to aid sleep. Remember, always consult your healthcare provider, especially if you have kidney disease or are on medications that interact with magnesium. Next up, we tackle vitamin B12, often called the energy thief because its deficiency silently drains your vitality. This vitamin is absolutely critical for your metabolism and the normal functioning of every cell in your body, particularly those in the bone marrow, gastrointestinal tract, and brain. For seniors, B12 deficiency is a significant concern, with prevalence rates ranging from 5% to a staggering 40%. The risk significantly increases with age, especially for institutionalized elderly or those with multiple comorbidities. The insidious story of B12 deficiency is its subtle, non-specific symptoms. It might start with just feeling tired, but if left untreated, it can escalate to tongue swelling, insomnia, weakness, and critical nerve-related symptoms like numbness or tingling. Your nervous system heavily relies on B12, so neurological symptoms like gait abnormalities, confusion, and changes in mental states can creep in. It's a leading cause of cognitive impairment, dementia, depression, and even psychosis in older adults. The challenge? Diagnosing B12 deficiency is complex. There's no single gold standard test. While a low serum B12 level is often used, below 150 pmol/L, some experts suggest higher cutoffs, 220, 258 pmol/L, are more sensitive, especially when combined with elevated homocysteine and methylmalonic acid, MMA levels. The payout for addressing this deficiency is profound. For many, oral vitamin B12 supplementation can be just as effective as injections, even in cases like pernicious anemia. The suggested oral dose is 1 mg, 1000 mcg, daily for a month, followed by a maintenance dose of 125 to 250 mcg daily for dietary insufficiency or 1 mg daily for pernicious anemia. It's remarkably safe with virtually no side effects. However, prompt diagnosis and treatment are crucial, especially for neurological symptoms and cognitive impairment, as delaying treatment can lead to irreversible damage. Be aware that certain medications like metformin for diabetes and acid-reducing drugs, proton pump inhibitors, can interfere with B12 absorption. If you're experiencing these subtle signs, talk to your doctor about testing your B12 levels. Our third silent threat is iron deficiency, which is far more common in older adults than many realize and extends beyond simply causing anemia. Iron is absolutely vital because it helps your body produce healthy red blood cells, which are responsible for transporting oxygen throughout your entire body and supporting cellular metabolism. If your iron levels are low, your cells aren't getting the oxygen they need to function optimally. The story of iron deficiency often begins subtly. You might feel fatigued, weak, experience shortness of breath, or notice your skin looks unusually pale. Dizziness is another common symptom. Older adults are particularly susceptible due to a variety of factors. Dietary intake might be insufficient, other vitamin deficiencies can hinder iron absorption, or chronic conditions and certain medications can interfere. Even hidden blood loss, perhaps from the gastrointestinal tract, can be a silent culprit. For instance, Helicobacter pylori infections are common in aging populations and can cause anemia. The good news, the payout, is that iron deficiency is highly treatable. A simple iron panel blood test can identify the issue. Treatment typically starts with oral iron supplements, which should be taken with food to reduce stomach discomfort. In some cases, if absorption is a concern or faster results are needed, intravenous iron might be necessary. To maximize your iron intake through diet, focus on iron-rich foods such as dark leafy greens, lean meats, and beans. Crucially, consuming foods high in vitamin C, vitamin B9, and vitamin B12 can significantly improve iron absorption. Conversely, limiting foods like dairy or those high in phytic acid around iron-rich meals can help prevent absorption blockage. Don't wait for your symptoms to worsen. If you feel off, speak up and get tested. Moving on to our fourth silent nutrient, we have vitamin D, famously known as the sunshine vitamin, yet many seniors are unknowingly lacking it. While your body can produce vitamin D when exposed to sunlight, several factors make older adults especially vulnerable to deficiency. As we age, our skin's ability to synthesize vitamin D from sun exposure significantly decreases after age 65. Additionally, limited sun exposure, common for those who are homebound or in nursing facilities, as well as darker skin tones, further increase the risk. The story of vitamin D deficiency often plays out subtly, making it easy to miss. Early symptoms might be as mild as a drop in your mood or feeling generally tired. You might dismiss it as just getting older, but this seemingly quiet sign can be your body's early warning. Left unaddressed, prolonged deficiency can lead to more serious issues like bone pain, muscle weakness, aches, cramps, thinning bones, and increased risk of fractures. Vitamin D is also essential for maintaining the balance of calcium and phosphorus in your blood and bones, supporting healthy tissues, and playing a crucial role in your nervous system, musculoskeletal system, and immune system. Medical conditions such as obesity, kidney or liver disease, and even certain weight loss surgeries can impair vitamin D absorption and utilization. The payout for addressing vitamin D deficiency is thankfully straightforward. Diagnosing it is simple with a blood test that measures your 25-hydroxyvitamin D levels. Treatment typically involves oral vitamin D supplements, with vitamin D3 being more easily absorbed by your body than D2. For adults aged 71 and older, the average daily recommended amount is 20 micrograms or 800 IU. While increasing dietary sources and safe sun exposure can help, supplementation is often necessary to reach and maintain adequate levels. Don't underestimate the impact of this sunshine vitamin on your overall well-being, from bone strength to mood and muscle function. Finally, let's explore zinc, a vital micronutrient that truly acts as a master regulator in your body, especially for cognitive function and immunity. Zinc concentration in the brain is 10 times higher than in serum, underscoring its crucial role in normal brain function. It's involved in over 2,000 enzymes and proteins, influencing everything from DNA and RNA synthesis to hormone regulation, cell signaling, and nerve development. The story of zinc deficiency in older adults is complex and deeply intertwined with aging. Serum zinc levels naturally decline with age, and this decline is even more rapid in patients with Alzheimer's disease. When zinc levels are insufficient, it can lead to a cascade of problems. On the cognitive front, deficiency is closely linked to cognitive impairment, memory issues, and even sleep disorders like insomnia, which itself can increase the risk of dementia. You might also experience loss of appetite, depression, or increased muscle catabolism. Zinc is also a crucial player in your immune system, and its deficiency can lead to immune aging, leaving you more vulnerable. Furthermore, it acts as a powerful antioxidant and anti-inflammatory agent, protecting against cellular damage and chronic inflammation, which are hallmarks of aging and age-related diseases. The payout from optimizing your zinc levels is widespread. While zinc is essential, it's also a double-edged sword, meaning maintaining zinc homeostasis is key, as both deficiency and excess can be problematic. Dietary intake of zinc is often insufficient in older adults. You can increase your intake by including foods like pumpkin seeds, which provide zinc that supports nerve regeneration and tissue repair. Moderate zinc supplementation can help alleviate cognitive impairment and support antioxidant and anti-inflammatory processes. For example, studies suggest zinc combined with melatonin can offer neuroprotective benefits and activate beneficial signaling pathways. Zinc transporters and metallothioneins are crucial proteins that help maintain zinc balance in cells and protect neurons. Researchers are actively investigating how modulating these zinc-associated proteins and pathways might offer therapeutic targets for age-related cognitive decline, including Alzheimer's and vascular dementia. However, further extensive experimental and clinical studies are needed to fully understand the optimal use of zinc in treating these conditions. Always discuss any supplementation plans with your healthcare provider to ensure it's appropriate for your individual needs. You've now uncovered 5 of the most critical yet often silent nutrient deficiencies that could be undermining your health and vitality as you age. From magnesium's role in balance to B12's impact on energy and cognition, iron's oxygen-carrying power, vitamin D's bone and mood support, and zinc's widespread regulatory functions, each of these nutrients plays an indispensable role in maintaining your independence and quality of life. Remember, those subtle whispers from your body, the fatigue, the low mood, the slight unsteadiness, are not just normal aging. They are often actionable warnings. The good news is that these deficiencies are largely manageable with early detection and the right approach. You are never too old to start making positive changes. Even small, consistent nutritional choices can lead to significant improvements. Focus on incorporating these nutrient-rich foods into your diet, and consider discussing targeted supplementation with your healthcare provider. Regular checkups and simple blood tests are your best allies in staying proactive and informed about your nutritional status. Your body has worked tirelessly for you throughout your life. Now it's time to repay that dedication. Give it the tools it needs to thrive. By addressing these often forgotten nutrients, you're investing in a future where you can stand strong, move with confidence, and fully enjoy every moment. If you found this information valuable, please hit the like button to help more seniors discover this crucial knowledge. Subscribe to Health Facts for more evidence-based strategies for healthy aging, and click the video on your screen right now to learn even more ways to boost your well-being. Share your own experiences with nutrient deficiencies or successes in the comments below. Your insights can empower our entire community. Here's to standing strong and moving with confidence at every age.